Please consult your physician, healthcare provider prior to beginning any exercise program. This is especially true if you have not been active for an extended period of time, or if you have any pre-existing health conditions such as heart condition, pains in chest, frequent loss of balance, feeling faint or having spells of severe dizziness, high blood pressure, bone or joint problems, and or leg weakness that could be made worse by a change in physical activity. Please exercise with caution within your own limits. No exercise should hurt. If any emergency occurs, dial 911 or visit your nearest emergency department. By participating in this exercise program, you are doing so at your own risk. Are voluntarily participating in these activities, assume all risk of injury to yourself, and agree to hold St. Joseph's Healthcare London, as well as staff and agents, harmless against claims and or damages related to your participation in this program.
Hi everyone, my name is Lea. I'm one of the rehab trainers with the Cardiac Rehab, Diabetes and COPD exercise program, and today we're going to be doing a little bit of resistance training. Before we get started, I would like to point out a couple things to you. Number one, make sure you're warmed up. So if you haven't warmed up yet, maybe you can pause the video for 5 to 10 minutes, walk around the house, maybe march on the spot, do some side steps, a little bit of a knee lifts, pushing with your arms. The purpose of it will be to get your breathing going, to get your heart rate a little bit going, warm up your ligaments, warm up your tendons, so you're not shocking your body. If you are using oxygen, make sure that it's turned up to a certain exact level you need for your exercise to keep safe and keep your oxygen levels up. Make sure you have your TheraBand ready if you use it. We're also going to be referring a couple of times to the pamphlet you all should have. We're going to talk about stretching a little bit at the end, and we're going to do a little bit of balance exercises as well. Just before we get started though, if you have any issues, bad knees, bad backs, bad shoulders, and your range of motion is limited, or you have injuries, make sure you do what you can. And if you need to do the range of motion exercises without TheraBand, absolutely go for it. We also recommend you to do about 10 to 15 repetitions at a time and build that up to 2 to 3 sets as you progress at home. So after you've done your warm-up, let's get started with your TheraBand. So let's take the TheraBand. Make sure you have it at the good tuck. And you're going to put it behind the back, over your shoulder blades, under your armpits. You're going to relax through the shoulders. You're going to keep your chin up and chest nice and wide. And we're going to start with the chest press. So you're going to exhale out forward and inhale, return. And good. So you're going to exhale and inhale, and exhale and inhale. You can also do one arm at a time if you find that both arms at the same time is too difficult. You can drop the TheraBand anytime you want or need, and try to aim for about 10 to 15 repetitions. So we're going to do 4 more. Good. And 3 more. Good. 2 more to go. Good job, everyone. Good. And last one. Exhale. Forward and return. Very good. Relax. Bring that band to the front. Again, make sure that you have a nice little tuck on it. If you have bad shoulders, keep your arms lower, about chest level. If you're feeling all right, you can lift those arms a little bit higher up toward the ceiling. You're going to keep your tummy tucked in, relax through your shoulders, and we're going to do the pull to your chest. So you're going to exhale on a pull, inhale and return. You're going to exhale and inhale, and exhale and inhale. Again, if you get tired, you can drop the band and just continue with without the TheraBand. Good. So I'm going to show you a couple of times like that. So you're going to pull down, squeeze the shoulder blades, and release, and squeeze the shoulder blades at the back and release. And exhale, 4 more, good. And 3, good. 2 more to go. And 1 more time, exhale, squeeze down and release. Very good. Relax those arms, relax through the shoulders. Make sure you breathe in through the nose, out through the mouth, and let's continue. So we're gonna have a seat. Grab your TheraBand if you have it. And you're gonna make sure you sit away from the back of the chair, so you're gonna engage your abdominal muscles. You're gonna keep your shoulders back, waist nice and long. So you don't wanna kind of push down on your lungs. You wanna make sure your breathing is nice and relaxed, and shoulders are back. You're gonna put that TheraBand under your feet in front of you. Good. And again, give it a nice little tuck and sit up nice and tall. You're gonna relax through the shoulders. You're gonna exhale, row in toward your waist and release. And release, good. And you exhale, good. And exhale, good. You can do one arm at a time. If both arms at the same time is too difficult, go back to one. You can also drop the band and just continue with your arms only. Good. So pull, squeeze right across the shoulder blades. Keep nice and tall. Good. And we're going to do 2 more. Pull it in and relax, and in and relax. Very good. Relax through the shoulders. Good. I'm going to put the band away for a second. We're going to sit up nice and tall. I'm going to work on your quads, top of your thighs. So you're going to sit tall, about hip width apart, 90-degree angle everywhere. Tuck your shoulders back. Make sure your waist is nice and long. We're going to take it one leg at a time. You're going to extend the knee and return. So you're going to extend and return. So you straighten that leg out. A little squeeze on top of the thigh so you feel your quad muscle, quadricep muscle on top of your thigh working for you. You want to make sure you're doing 10 on each leg. So you count up to 10 on one leg and then the other, or total counting up to about 20. You can do between 10 to 15 repetitions. You can certainly build up for it, starting with the 10 and then building up. Good. Sitting nice and tall, exhale and inhale. So slowly up and down. Good. Make sure you relax through your shoulders. Keep your collarbones nice and wide. That helps with the breathing. Good. And lift. Perfect. We'll do 4 more. So we're close to 10 on each side. You can always stop if you feel tired. 2 more to go. Exhale. Good. And 1 more time. Exhale and release. Very good. Shake those legs out. How are we doing? Hope everyone is feeling great. Good. So let's grab the band again. We're gonna put it under our feet 1 more time in front of you. And this time we're gonna do a little bit different exercise. Now, my chair is not ideal because it has these handles, so it's gonna be on my way a little bit. At home, it's better if you use a chair without the arm supports, so you can actually extend your arms along your side a little bit better. So sit up nice and tall, and you're gonna tuck your shoulders back, relax through the shoulders, and we're gonna keep our elbows straight this time. Make the band long enough that it's not too difficult. And you're going to pull back behind you, exhale, and return, inhale. And return. You exhale, and you inhale, and you exhale. Good. And inhale. You're going to do 1 arm at a time. Again, good. Pull back and release. Pull back and release. I'm going to drop the band. You continue. You can also do it without the band. So what you want to do is pull through the shoulder blades, squeeze them together at the back, keep those elbows straight, and kind of push through all the way to the back. So we're going to do 2 more. Good. And 1 more time. Exhale and release. Very good. How's everyone doing? Okay, take a break anytime you need to. We'll do one more exercise in seated position, and we're going to go up and do a couple of things standing. So we're going to work on your core. So again, you want to make sure that you're sitting away from the back of the chair, so you have a little bit of space between your back and the chair, back of the chair. You're going to sit up nice and tall. The easier version of the exercise is to keep your hands on your knees. A little bit harder, you cross your arms across your chest. Again, if you feel you can do this, great. If you feel this is too hard, place your hands back on your knees, and we're going to do it together. So you're going to exhale, tighten the belly, lean back a little, and inhale, return. Exhale, inhale, return. Keep going. What you want to do is make sure that your neck is nice and relaxed. You don't want to tense up your shoulders. It's going to cut into your breathing a little bit too much. You want to make sure you tuck the belly in the front so you take the stress off your back. So when you hinge back, you're nice and tight in the front, relaxed from the shoulders, and continue breathing. You're going to exhale and inhale. Stay nice and tall from your waist. Good. Make sure nothing hurts. You should not feel your lower back too much. You should not be arching your back. You should not be slouching. You should be keeping that back nice and straight. And how do you achieve that? By tucking the belly in the front. Good. 2 more to go. Exhale. Good. And one more time. We're going to exhale. And we're going to inhale. Very good. How's everyone doing again? Good? All right, let's get back up. I'm going to go behind the chair, and I'll show you from the side so you can see what we're doing. So you're going to stand right behind the chair, not holding on to, but kind of placing your fingers on it. I always tell, treat it like a hot stove. You don't want to lean in. You don't want to put too much weight forward because that puts a lot of stress on your back. So what you want to do is you want to kind of use it for balance a little bit, but make sure overall you're staying nice and tall. You're going to stand on one leg, and you're going to tap the other one behind you so your knees are close together and don't move too much. So what you're going to do is you're going to work on that one leg. You're going to curl that heel up, and you're going to lower it down. Exhale, curl, inhale, lower. And again, we're going to do anywhere between 10 to 15 repetitions on one side. Good. Good. I'm about 5 now. Good. So let's keep going. Good. And curl. Good. And curl. Good. So exhale. 3 more. Good. And 2. And last one. Out and in. Very good. Relax a little bit. I know your standing leg was getting tired. The leg you were working on was getting tired, so shake it out a little bit. And again, take a break anytime you need to. If you need to sit down, sit down. Take a break. You can always do something else if this is too difficult for you. Nothing should hurt. Should it be a little bit difficult? Absolutely, you're exercising. So make sure you get a little bit of exercise done for your muscles. But you feel tired, or if something hurts, stop and don't continue. Take a little bit of a break. We're going to switch and do the other leg now. Okay, good. So sit up nice and tall, tuck the belly in, keep your back straight, tap that toe behind, keep your knees together. Now curl and release, and curl and release. Good, so you exhale on the curl and inhale. Exhale and inhale. Good, and curl. Good, 5 more to go, everyone. Good job. And 4. Good. And last one coming up. Good. And release. Very good. Shake it out. Now, let's grab the band again. Oh, by the way, you should drink some water in between. So here goes. Make sure you always drink water. You need to dehydrate yourself and your muscles. Okay. So now, if you can, let's stand and stay standing. If you can't, you can do this exercise seated as well. So I'm going to start with the standing up, and I'm going to switch in between to show you how you can do it in seated position. So you pick and choose. And let's get started. So you're gonna step right in the middle on top of the band, right there. You're gonna cross the band in the front, and you're gonna straighten yourself out. So your waist is again nice and long, tall, shoulders are back, collarbones are nice and open. Tuck the back a little bit so you're nice and tall. And then you're gonna pull up toward your chest. So you're gonna exhale leading with those elbows, and you're gonna inhale, release. You're gonna exhale, and inhale, release. You can do one arm at a time, good, and release. You can also do it without the band. So you're gonna row up and release. So it's called upright row. You're gonna keep your shoulders nice and low, relax through the neck. Good. I'm gonna show you a couple of times now seated. So you keep going. If you're done about 15, you can stop. So you can keep those arms along your side, and you're gonna pull up just like this. Up and release. Good. And let's do one more time. Curl up and release. All right, relax through the shoulders. Feeling all right? Take a break anytime you need to. Good. I'm gonna get back up now. So we're gonna do a couple of exercises for your arms. So again, again, step on top of the band. This time we're not gonna cross it. You can do this seated as well. You can put it under your feet, just like I'm doing here. Seated, your arms are hanging on the side. And we're gonna do the bicep curl. So you're gonna keep your elbows tight. You're gonna turn your palms out. And you're gonna curl up toward your shoulders. And you're gonna release. So nice and slow. And release. For you guys, it's very important to try to get a nice deep breath in and nice deep breath out. So you would inhale through the nose and exhale through the mouth. So you're gonna exhale. Good. One arm at a time. Or just arm movements. Exhale. So we're gonna do 4 more. And 3. Good. And 2. And last one. Good. Curl up and release. Very good job again, everyone. So let's give your shoulders, arms a little bit of a break, and we're going to do a calf raise. So again, you're behind the chair. Make sure you're not leaning in too much. Keep your shoulders back, collarbones nice and wide, tight back, chin up, relax through the shoulders. You're standing about hip width apart, just about like this. And you're going to make sure that you're nice and tall, and you're gonna roll and lift those heels up, and you're gonna touch them back down. Lift them up, touch them back down. So you're gonna exhale and inhale, and exhale and inhale. You wanna make sure that you're not rocking forward and back too much or swinging your hips. So you wanna keep everything nice and tight. Good. And exhale. Good. And lift. And again, we're going to do about 10 to 15. Good. So I'm guessing we're about 8 or 9. Good. So let's do 3 more. Good. And 2 more. Good. And last one. Up and release. Very good. Relax through the shoulders. Good. So grab the band one more time. So we worked our biceps. We also now need to work your triceps. So what you're gonna do is you can double the band up, or you can do one side or one half of it. Up to you. If you double it up, it's gonna be more difficult. If you just use one side, it'll be a little bit easier. So what you wanna do is you wanna hold somehow that band close to your chest somewhere, across or on the side you're doing. And then I'm gonna show you from the side how it looks like. So you're gonna grab that band, give it a little bit of a tuck, make sure your elbow is tucked in at this time, and you're gonna extend that arm down and back and release. You exhale and inhale. Good. So you exhale and inhale. Like I said, you can do one half of the band at the same time. Good. and you exhale and inhale. Good. And exhale. Very good. So we'll do 4 more on this side, and 3, and 2, and last one. Out and release. Very good. We're going to switch sides. So same thing, holding on right in front of you, either both or one, and you're gonna turn the side. You're gonna hold on, elbows tucked in. You're gonna exhale and inhale. Where should you feel it? On the back of your arm, on your tricep. So you're gonna exhale and inhale. Good. Make sure you're relaxed through your shoulders. Deep breath in and out. Keep those collarbones nice and wide, shoulder blades tucked at the back. That keeps the stress off your lungs and it's a little bit easier to breathe. So 4 more, good. And 3, and 2, good. And last one, exhale and inhale. Very good. How is everyone doing? Okay? Perfect. So let's get rid of the band. We've covered pretty much all the major muscle groups. We worked on your legs a little bit, front and back. We worked on your chest. We worked on your back, arms, front and back. We did calf raise, which is for your lower leg. So we're going to do a little bit of balance now. So let's talk about balance. Balance is very important. We want to make sure that everyone does the balance because that helps us to keep stable and avoid falls, right? So we're going to stand on one leg, probably closer to the chair. Again, make sure you don't lean in. You're going to keep yourself nice and tall, waist long. You're going to lift that one leg up and you're going to try to balance. So you can either hold your hands out to the side if you feel you can, or just keep that hand again close to the chair. Like again, treat it as a hot stove. So you don't lean in, but you try to balance. Good. You're going to hold and hold and hold and hold. So we're going to do 5 more seconds. 4, 3, 2, 1, and release. Good. Relax through your legs. Again, you can turn around, you can face the chair, you can do it any way you want. And we're going to do the other leg. So lift the leg off the floor. You're going to try to balance if you can. And you're going to hold nice and tight. And make sure you breathe. Don't hold breath. So inhale and exhale. You can try to aim up to about 15, 20, 25, 30 seconds. And you hold and you hold. You should feel a little wobbly, just like I do right now. That way you know you're working on your balance. Good. And then hold and hold, hold and hold, and release. Take a little bit of a break and shake it out. Another exercise you could do for your balance will be sort of like a heel-toe walk. So you can either go forward and back along the chair, along the island. If you have, you could go around the dining room table, walk forward. Then the trick is that don't turn around, try to walk backwards. So you're going to pull toe to heel, toe to heel. Again, try not to lean in too much. Try to do it on your own. And if you need a little bit of help, it's right there. Hallway will be a great way to do it because you can walk through the hallway, hold one hand close to the wall instead of leaning in, and they can practice that forward and back walking. Good. There and there. Good. And one more time. Forward. Ew. I'm losing my balance here. Good. Okay. Now, shake it out a little bit. You can put the spin on this. So you can stand heel to toe and keep yourself nice and tall. Hold on a little bit, not too much. And you're going to rock forward onto your toes. You're going to rock backwards a little bit onto your heels. So you're going to rock forward and you're going to rock back, rock forward, and rock back. So it's a little spin on your balance right there. Good. And release. Excellent. Good. So it's time to stretch. While we're stretching, we just use our muscles, so we need to make sure that you stretch them out and you don't get sore. So let's start with the quad stretch because we worked on those muscles. So what you want to do, again, if you can reach, is hold on to the chair and grab the ankle, and you're going to straighten yourself out, trying to keep your knees close together. relax through the shoulders, and feel the stretching on your thigh, upper leg in front. So you're going to hold. You know, all of you know that we should be holding our stretches between, I would say, 20 to 30 seconds. Stretching should not hurt. You should feel a nice, gentle pull on your muscles, but not pain. So hold and hold. Don't forget to breathe. So breathe in, breathe out, breathe in, breathe out. Good. Deep breath in. And out. And then slowly relax your leg. We're going to shake it out. I'm going to switch over. I'm going to use this one so I don't turn around. You're going to grab your ankle. You're going to stretch yourself out. And you're going to hold yourself tall, pulling that ankle gently up, feeling the stretch in the front, but not pain. Good. If you have bad knees or you're very tight and you can't reach, what you probably should be doing, I'm going to turn, can grab your pants here to get your ankle a little bit lower. You can use a towel or a belt at home. You put it over your ankle or under your ankle actually, and you're going to then hold on to that either belt or your towel and gently pull that leg up. So it looks like this. So you're going to hold and hold. Good. And then slowly lower down and relax. Let's stretch your calves. So very gentle lean into the chair or wall. You're going to take a step back and you're going to push that back heel down, keeping everything nice and tight. Shoulders up, so make sure you don't lean heavy into the chair again. So you're going to push the heel down, lean gently forward. You should feel the stretch on your calf. So breathe in, and in, and out. Good. One more time, in, and out. Perfect. Let's step in. We're going to switch sides. Take that long step back. Push the heel down, very gently leaning forward until you feel the stretch on your calf. Take a breath in and out. Good. In and out. One more time. Breath in and breath out. Perfect. So step back in and we're going to go and have a seat. Now, if this was too long standing up, you can always go back and forth between the seated exercises as well as standing exercises. And like I said before, most exercises we did today can also be done seated. So we're going to stretch your hamstring. You're going to sit up nice and tall. You're going to place one heel in front of you. You're going to have a nice square position. You're going to keep your shoulders back. And you're going to, with the flat back, lean a little bit forward or hinge forward, tip forward from your hips, keeping the back nice and straight. You should feel a stretch on the back of your leg. Deep breath in and out. And if you don't know how many seconds you've held your stretch, I would recommend you to maybe not even count your seconds, but take nice deep breaths in and out about 5-6 times. So when you do that, you are doing at least 20-second stretch. It also helps you to breathe nice and deep, gives you a nice relaxation at the end. Good. And then bring it back up. Switching those legs. Heel goes forward, chest lifts up. You're going to tip forward, hinge forward from your back, from your hips, sorry. And you're going to keep that chin not tipping forward or too high up. So you want that back to be nice and flat all the way from the bottom to the top. So you inhale and exhale. And you inhale and you exhale. Very good. And slowly bring it back up. And let's do a chest stretch. Again, you have a chair at home which doesn't have armrest. It's a little bit better. I would take a deep breath in, reach those arms up toward the ceiling, and then open the chest without arching your back. Now, if this is hard on your shoulders, you need to lower your arms down a little bit more. But the point is that you want to try to get a nice stretch across your chest. So take a breath in. Good. Deep breath in and exhale. Good. Bring those arms back and relax. And we're going to tie those arms together at the front and round the back a little bit. Push your hands away. So you should be feeling a stretch across your shoulder blades and at the back, right there. So round. Good. Hold and hold. Breath in and out. Good, and release and relax those arms. Let's do a neck stretch at the end. Keep your chin up, back straight, shoulders back. You're gonna turn your head to look over your shoulder. So it's that blind spot check when you're driving the car. So you're gonna keep your shoulders relaxed. Good, breath in and out. One more time, in and out, and slowly bring it over to the other side. And deep breath in and out.
The fire alarm system for St. Joseph's Hospital is now offline. In case of emergency, please dial
Good.
55555.
And bring that head back in. Relax through your shoulders. Good, we're done. But before you go, I want to remind you a couple of things. So, number one, make sure you drink some water in between exercises. Make sure you warm up 5 to 10 minutes before you start by either walking around the house, doing some movements where you actually warm up. You can do all these exercises either with your band or no band and just range of motion. If something hurts, stop. If something is uncomfortable, adjust so you feel good doing what you're doing, and you should be aiming to do 10 to 12 repetitions. Ideally, if you do this regularly 3 times a week, you could build up to 2, maybe 3 sets. But start definitely with 1 set of each if you haven't done it for a while. Also refer back to the pamphlet we gave you. So there is most of these exercises. We didn't do them all, but we did most of these one way or the other. So make sure you get some ideas from there. Also, we gave you this sheet with stretching. So at the end, just like I did few stretches today, you can certainly work your way through these stretches and feel really good at the end of the workout. And I believe that you also have been given a couple of balance exercises on the sheet. So we did few of them. Again, recommending to do them. Actually, these exercises could be done every day, and it is very good for your balance and avoid falling and keeping yourself healthy and safe. Good. Well, it was a pleasure having you guys in my virtual class today. Have fun at home and stay safe and stay healthy.